You're here because the burning, tingling, numbness or that walking on pebbles feeling has started to steal little pieces of your day. The good news? There are evidence-backed nutrients that can protect nerves, calm pain, and even help damaged fibers repair. Today, we're going deep on the 5 supplements every diabetic should consider for neuropathy. How to take them, what to expect, and how to stack them safely with your meds and meals. Stick around to the end for a simple stack and track. Routine plus ready-to-use video titles and thumbnail text. Quick note before we dive in, this video is education, not personal medical advice. Always loop in your clinician, especially if you're on diabetes meds, blood thinners, thyroid meds, chemo, or have kidney, liver, gallbladder issues. 1 vitamin B12 methylcobalamin. The nerve insulator if neuropathy is a frayed electrical cable. B12 is the insulation. B12 maintains and repairs the myelin sheath, a protective coating that lets nerve signals travel cleanly. Low B12 looks a lot like diabetic neuropathy. Numbness, pins and needles, burning feet, weakness, gait changes, brain fog. Here's the twist. Metformin, one of the most common and effective diabetes meds, can slowly deplete B12 by impairing absorption. Age, low stomach acid, and reflux meds can add to the problem, so you can have good glucose control and still feel worse. If B12 is quietly slipping, what it does for neuropathy helps remyelinate nerves, lowers inflammatory byproducts homocysteine, improves blood flow to nerves, and supports regeneration. Over time, in several trials, 1,000 mcg day of methylcobalamin improved sensory symptoms and nerve conduction, with even stronger effects when deficiency was present. Methylcobalamin is the active form your body can use it immediately, without conversion steps. Cyanocobalamin can work too, but methylcobalamin is the nerve-friendly go-to in most studies. How to use it? Ask your clinician to check serum B12, methylmalonic acid, MMA, and possibly homocysteine. Lab normal is broad. For nerve health, you generally want B12 comfortably above the low end. If you're low, doctors often start with injections. They bypass absorption issues and then maintain with oral or sublingual methylcobalamin. Typical maintenance, 1,000 mcg daily or a few times per week. Adjusted by labs and symptoms. Food sources, beef, liver, clams, sardines, salmon, eggs. Plant-based eaters almost always need a supplement. B12 is water-soluble and very safe. Mild nausea, rash, or dizziness are uncommon. If you have kidney disease, review dosing with your clinician. Takeaway: if you're on metformin or your symptoms are progressing despite reasonable glucose screen and correct B12 first. It's simple, inexpensive, and foundational to Acetyl-L. The anti-oxidative Firehose glucose bathes nerves in oxidative stress. ALA is a universal antioxidant. It works in water and fat compartments. It recycles other antioxidants, vitamin C, glutathione. In neuropathy studies, intravenous ALA 600 mg per day for 2 to 3 weeks has consistently reduced burning, numbness, and pain, often within days, by dialing down oxidative and inflammatory signals and improving microcirculation to nerves. Oral ALA can help too, but absorption varies. Many people respond at 600 mg per day. Some split 300 mg twice daily. If you try oral first, give it 8 to 12 weeks before judging. Look for Arella or stabilized sodium Arella, the naturally occurring isomer, for better bioavailability. Take it away from high-carb meals if possible. Some feel best 30 minutes before lunch and dinner. Cautions: ALA can lower blood sugar. So if you're on insulin or sulfonylureas, monitor closely and coordinate dose adjustments. It may interact with thyroid meds and certain chemotherapies. Get the all clear from your team. Side effects are usually mild nausea, dizziness, metallic taste. Start low, build up. Takeaway: for burning pain and tingling, Isla is the fastest-acting ADON many people notice. 4 yields the strongest evidence. Oral can still be worthwhile when used consistently. 3. Acetyl-L-Carnitine ALK. The nerve energizer and rebuilder nerves are energy-hungry. ALC ferries fatty acids into mitochondria, your cell's power plants, and has direct neurotrophic effects, supporting regeneration and improving nerve signal conduction. Several trials show reduced neuropathic pain and better nerve conduction. With 1,500 to 3,000 milligrams per day, divided twice or 3 times daily. Benefits tend to build over 2 to 6 months. This is a slow, steady rebuilder, not an overnight painkiller. Why acetyl-L-carnitine and not plain L-carnitine? The acetyl form crosses into the nervous system more effectively. Food has tiny amounts. Red meat, fish, dairy, avocados, but you won't reach therapeutic levels without supplements. How to start? Begin at 500 to 1,000 milligrams day. Then, titrate toward 1,500 to 2,000 milligrams day based on tolerance and benefit. Side effects are usually mild nausea, stomach upset, rare restlessness, insomnia. A small subset notice a transient fishy odor-reducing dose, or adding a chlorophyll tablet can help. If you have kidney disease, carnitine can accumulate. Medical guidance first. Interactions may potentiate blood sugar-lowering meds. Monitor. Check with oncology or endocrinology if you're on thyroid chemo regimens. Takeaway: think of ALK's long-game nerve, nutrition powering repair and smoothing signals over weeks to months. For omega-3s, South EPA, DHA. The calmed inflammation duo. Diabetes raises systemic inflammation. Nerves feel it first. EPA and DHA from fish oil. Algal oil for vegans help resolve inflammation. Protect nerve membranes, improve microvascular blood flow, and support overall cardiometabolic health. Big deal when you're diabetic. Evidence studies show improvements in nerve conduction and symptom scores in many, not all, trials, plus reliable benefits for triglycerides and cardiovascular markers. A practical target is 1,000 to 3,000 milligrams per day combined EPA plus DHA. Read labels. 1,000 milligrams fish oil is not the same as 1,000 milligrams EPA plus DHA. Choose molecularly distilled third-party tested oils to avoid contaminants. Take with meals to prevent fishy burps. Enteric-coated capsules help. Interactions and cautions. Fish oil can thin the blood. If you're on warfarin, DOACs, high dose. Aspirin, NSAIDs, or you bruise easily. Clear the dose with your clinician. Very high doses may modestly lower blood pressure or affect immune function. Stay within recommended ranges unless supervised. Takeaway: omega-3 South are your everyday anti-inflammatory base, lying good for nerves, eyes, heart, and the whole metabolic picture. 5. Curcumin from Turmeric. The inflammation switch. Chronic hyperglycemia flips on inflammatory pathways that sensitize pain fibers and slow nerve repair. Curcumin flips many of those switches back down. It blocks NF-B and other inflammatory mediators, scavenges free radicals, and shows early evidence of supporting nerve regeneration. Small human studies and stronger animal data are promising. Clinicians use it as a safe, multi-target adjunct rather than a standalone cure. Dose and form matter a lot. Plain turmeric powder has very little curcumin and is poorly absorbed. Look for standardized extracts with bioavailability enhancers. There, piperine black pepper extract or phytosome, liposomal curcumin phospholipid complexes. Typical supplemental range: 500 to 2,000 milligrams per day as curcuminoids. Divided with meals, cautions: curcumin can lower blood sugar a bit. Monitor if you're tightly managed on meds. It can interact with blood thinners and sometimes irritate the stomach in high doses. Avoid if you have active gallbladder obstruction unless cleared by your doctor. Choose third-party tested products to avoid fillers, heavy metals. Takeaway: Curcumin is the broad anti-inflammatory layer that can make everything else work a little better, especially when pain is driven by angry nerves. So, what should you start with? If you're on metformin or haven't checked lately, test. And correct B12 first. For fast symptom relief, add ALA. For the long game of repair, layer in ALC. Keep omega-3 south as your daily anti-inflammatory base. Use curcumin to further dial down pain signaling and oxidative stress. Most people do well starting with 1 or 2, then building a stack over 2 to 4 weeks while watching glucose and symptoms. The stack and track routine, simple. Sustainable morning with breakfast. Omega-3 EPA DHA to hit your daily target. Curcumin, bioavailable form with food. Late morning or lunch 30 minutes before or away from high-carb meals. ALA, 300 milligrams or the full 600 milligrams per day if you prefer once daily. Afternoon, evening. With food LC, 500 to 1,000 milligrams. Work toward 1,500 to 2,000 milligrams day in 2 to 3 doses closing parenthesis, evening anytime. Sublingual works well. B12 methylcobalamin, 1,000 mcg. Adjust by labs. How to know it's working? Keep this super simple. A 0 to 10 pain tingling score each night. Takes 15 seconds. A quick sock test. Close your eyes. Slide a thin sock over your toes. Can you feel fabric equally on each toe today versus last week? A 10 to 15 minute walk after 2 meals. Note, if post-meal burning eases sooner over 2 to 4 weeks. Recheck labs. Your clinician recommends B12 MMA, A1C, lipids, liver enzymes on their schedule. Safety quick checks worth repeating. Tell your clinician exactly what you're adding and your doses. If you use insulin or sulfonylureas. Check glucose more often when you start ALA, curcumin. KQ may run a little lower. If you're on blood thinners, get clearance for omega-3 south and curcumin. Kidney disease, ask before higher dose ALC. Discuss B12 dosing strategy. Start low. Add 1 supplement every 7 to 10 days, and only increase if you tolerate it. What results to expect? And when ALA, quickest subjective reliefs, sometimes within 1 to 3 weeks. Fuller effect by 8 to 12 weeks. B12. If deficient, energy and sensation can improve in weeks. Structural nerve repair continues over months. ALC, gradual, but meaningful improvements in pain and nerve conduction over 2 to 6 months. Omega-3s. Systemic benefits within 4 to 12 weeks. Nerve comfort often follows. Curcumin, pain inflammation changes over 2 to 8 weeks, especially when combined with the rest. None of these replace glucose control, movement, sleep, and foot care. They amplify the progress you make with those pillars. Conclusion: neuropathy feels relentless until you give your nerves the inputs they need. Lower glucose swings, lower inflammation, better antioxidant capacity, and the specific nutrients that rebuilds wiring. This 5-part stack delivers exactly that: insulation, B12, fire control, ALA, and curcumin, fuel delivery, ALK, and calm rivers around the cable's omega-3s. Build it thoughtfully, track simply, and give it time. Drop a comment with which supplement you're starting first and what your biggest symptom is: burning, pins and needles, or numbness. I'll help you fine-tune your stack in the replies. And if this helped, hit like and subscribe so more people can find it.